Good day everyone. I will discuss case study, control and treatment of Streptococcus disease in red tilapia Oreochromis and Asian Seabass, late skull carifer. Objective: Number 1 is to understand the Streptococcus disease, to evaluate the effect of Streptococcus disease, to differentiate the effort of Streptococcus disease on red tilapia and Seabass, to know the control and treatment of red tilapia and Seabass affected in Streptococcus disease. Class is to be update on new studies on control and treatment Streptococcus disease. Background and introduction. Streptococcus infection. History. Streptococcus inei is known as cause disease in both fish and mammals, including humans. Streptococcus inei was first stated from an Amazon River dolphin in 1970s and 1994. Inei was reported as the disease agent from an outbreaks in tilapia hybrids. However, it was later determined that tip strep was identical, first isolated from tilapia from Israel 1984. Causative agent: Streptococcus agalactiae, including the previously described, now reclassified as agalactiae. In the major causes, streptococcus in farm tilapia also cause mortality but a lesser extent. Streptococcus and gram-positive non-acid fast, non-motile, oxidase positive, catalase negative cocci. There is an obvious difference on the clinical sign induced by one other and Streptococcus species. External: abnormal behavior due to tropism of the bacteria for the central nervous system, shriveling behavior, lethargy, bent bodies, and disoriented of fish commonly observed. Eye lesions: sick fish have eye lesions such as edaphthalmia of exophthalmia, unilateral or bilateral. Opacification of the eye can also be associated with the previous sign, and eyes hemorrhage and common. However, not all fish affected with Streptococcus necessarily have eye lesions. Epidemiology: outbreaks usually take place when fish have been exposed to stress such as an increase in water temperature, suboptimal oxygen level in water, or overcrowding for a long period of time. The disease is transmitted horizontally from fish to fish via cannibalism, skin injuries, etc., and also from the environment of the fish. Streptococcus can be theoretically affect all fish size. However, bigger fish from 100 gram to market size are usually more susceptible to the disease. The disease can be acute with peak of mortality lasting 2 to 3 weeks during the high water temperature season. However, it may also chronic when water temperature is lower, causing a lower but resistant level mortality. Streptococcus disease in red tilapia Oreochromis. Streptococcus is a neurologically bacterial disease that affects warm water fish in either salt and freshwater environments, typically in tropical regions. High stocking densities, poor water condition, and high temperatures are the most favorable condition of streptococcal outbreak. Tilapia streptococcus infect fish from young and 5 grams and is present throughout the entire tilapia growth cycle. In Asian Seabass, late skull carifer. In Asian Seabass disease, symptomatic characterized by massive acute mortality peaks, with cumulative mortality of 70% being very common. Infection can occur throughout the entire growth cycles but the more often seen in large and harvest size of fish. therefore considered to be an expensive disease for farmers who will experience a loss of production efficiency and marketable production, or more importantly, to reduce production in overfeeding conversion rates. Epidemiology of Streptococcus disease. Outbreaks usually take place when fish have been exposed to stress such as an increase in water temperature, suboptimal oxygen level in water, or overcrowding in a long time period. Disease is transmitted horizontally from fish and fish via cannibalism, skin injuries, and also from the environment of the fish. Streptococcosis can be teriologically affect fish all size, however bigger fish from 100 kg market size and usually more susceptible to the disease. The disease can be acute with peak mortality lasting 2 to 3 weeks during the high water temperature season. However, it may also be chronic when water temperature is lower, causing a low but resistant level of mortality. In result and discussion, fish epizootics. Natural infected Asian Seabass exhibited typically clinical signs of streptococcal infection, including loss of equilibrium, exophthalmia, and opacity and eyes, loss of appetite, lethargy, and irregular movement. Some fish show darkening of skin, echinacea, and petacea on the operculum and proximal margins of the pectoral fins, with red tilapia and disease signs of streptococcal infection were similar to those observed in infection in Asian Seabass. Histopathology changes in red tilapia. Experimentally inoculated Asian Seabass and red tilapia exhibited 0 to 60% mortality within 10 days. Disease signs due to experimental infection were similar to those in infected fish found in commercial fish farms. Example of some clinical signs are shown. Figure 1-2. Inoculation and isolation of DNA from dead fish establish of organism as pathogenic from the fish and confirm. Asian Seabass. Conventional and rapid identification system, as well as the polymerase chain reaction, were used in determining that the isolates was the virulence of this DNA was higher in Asian Seabass than in the red tilapia, as shown by 10 days in Asian Seabass, are red tilapia being 1.08 times 104 and 1.14 times 107 CFU effectively. Histopathological changes in Asian Seabass are more reserved than those observed in red tilapia. The changes can be found in several organs including liver, pancreas, heart, eyes, and brain. Histological findings included cellular sexuaries in infiltration of sympocytal and granula formation in the infected organs. Control and treatment of red tilapia and Asian Seabass affected by Streptococcus disease. First is decreasing feeding. During acute Streptococcus outbreaks, particularly and totally reduction of feed can help to control and reduce the mortality rate. Of the hypothesis to explain this phenomenon is that the bacteria are present in the water and their uptake is facilitated in feeding. Second, decreased stocking density. High productivity in tilapia farming is achieved by balancing a higher stocking density with a good survival rate. When mortality increases, lowering the stocking density helps a lower both in stress stress level and the pathogen load within a population, keeping optimal oxygen level. Third is lower the water temperature. High water temperature is both stress from the fish and preferential condition for the bacteria to develop. Therefore, lowering the water temperature. Fourth is antibiotic treatment. Antibiotics are the only effective in treating the streptococcus outbreaks. If treatment is applied very early during the course of disease, however, in most cases, oral antibiotics are ineffective. Fish have reduced appetite. Last is vaccination. Presently, there are no effective commercial vaccine to prevent streptococcus outbreaks in tilapia. However, in the near future, vaccination will be the key for preventive technique to combat this disease and decrease its devastating economic impact on tilapia farming. Related study and updates on the prevention and treatment of Streptococcus disease. Farming of red tilapia. Isolation and molecular characterization of streptococcal species recovered from clinical infection in farm Nile tilapia or Euchromis niloticus in the Philippines. Streptococcal disease cause severe losses for global tilapia farming, especially in developing countries. The aim of this study was to identify the characterize the streptococci recovered from Nile tilapia farm in the Philippines. Moribund and apparently healthy fish were sampled from grow-out cage, pond, and hatchery. Clinical signs observed included exapothermia, eye opacity, ascites, lethargy, erratic swimming, and hair mortgage. Result how but showed that both Streptococcus and in Streptococcus rarity to associated with disease in these sites. Consistent with global reports including those from Southeast Asia, was more widespread than molecular resotyping of C. agalarti isolates identified the serotype histopathological findings were meningitis. All strains were susceptible to those tasted antibiotics and resistant to oxalic acid. Culture of Seabass. Susceptibility to freshwater rearing Asian Seabass leads calcarifer to pathogen Streptococcus ani. Asian Seabass leads calcarifer was being recognized as an economically important aquaculture species which can be adapted to and cultivated with wide range and salinities. The number of freshwater intensive seabass farm in Thailand is increased manually. Here they first described in susceptibility Asian seabass which were cultured in freshwater to Streptococcus nei and their pathogenically changes. The isolates of Pulative were identified using combination of standard biochemical assay and species-specific prior subjected to a vivo challenge. Accumulated mortalities of the fish which received 10 fish. Clinical signs such as erratic swimming and opaque eyes were identified from a few affected fish. while the most died rapidly without any abnormal signs. Histopathological in main manifestation were observed in multiple organs, kidney, liver, and brain. Hemorrhage, hyperemia, circular degeneration, and inflammatory cells infiltration were commonly found within the internal organs, notably the formation of numerous enzyme-like session aggregated eosinophilic cells resembling macrophages were typically found in the brain and infected fish. Summarily, this study first revealed that freshwater rear Asian sea bass is highly susceptible to infection. The hemorrhagic septicemia was a major pathogenical changes that could be found in the infected fish. Conclusion: Streptococcus disease is a neurologically bacterial disease that affected warm water fish, either salt or freshwater environment, typically in tropical region. Naturally infected Asian sea bass exhibited typically clinical sign of streptococcal infection, including loss of equilibrium, exopotamia, and opacity and of the eye, loss of appetite, lethargy, and irregular movement. Some fish show darkening of the skin, emaciation, and petection on the operculum and proximal margins of the pectoral fins. Ineffective ways to prevent strep disease in fish included practices good water quality, providing proper nutrition, keeping the environment clean, and quarantining new fish before adding them to an existing collection. While red tilapia, the disease signs of the streptococcal infection were similar to those observed in infected Asian sea bass. Expect that body supplementation was found. Continuous research will be the best way to keeping update. References. Thank you.